Loratadine-D is a combination of an antihistamine and a decongestant. The antihistamine, loratadine, helps with symptoms like watery and itching eyes, runny nose, and sneezing, which are common in seasonal allergies. The decongestant, pseudoephedrine, works to relieve a stuffy nose, promote sinus draining, and improve breathing. It's important to note that this medication is not recommended for use in children under 12 years of age due to the high amount of pseudoephedrine. For adults and children over 12, the recommended daily dosage is typically 1 tablet every 12 hours. It's best to take Loratadine-D at the same time every day to maintain consistent levels in your body. When taking Loratadine-D, it's important to follow your doctor's instructions. Typically, you'll take it once a day with a full glass of water. It's important to swallow the tablets whole and not crush or chew them. Taking it as directed helps reduce the risk of side effects. Be sure not to take more than directed, and avoid taking it for several days before allergy testing as it can affect the test results. If you have any questions, it's best to consult your doctor or pharmacist for more information. Some common side effects of Loratadine-D may include dry mouth, mild stomach upset, trouble sleeping, dizziness, headache, nervousness, loss of appetite, or thirst. If any of these effects last or worsen, it's important to inform your doctor or pharmacist promptly. Your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. However, if you experience fast or irregular heartbeat, uncontrolled shaking or tremor, mental/mood changes, or difficulty urinating, it's important to notify your doctor immediately. In rare cases, a serious allergic reaction may occur. Seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. As for the best time to take this medication, it is typically recommended to take Loratadine-D once daily with or without food. Be sure to follow your doctor's instructions regarding dosage and timing. Before taking Loratadine with pseudoephedrine, make sure to speak to your doctor or pharmacist if you have any allergies, especially to desloratadine, or if you have experienced serious side effects from similar medications. This product may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, problems with urination, high blood pressure, diabetes, heart problems, thyroid problems, or glaucoma. This medication may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness until you know how this medication affects you, and to limit alcoholic beverages. If you are using marijuana, make sure to talk to your doctor. Older adults may be more sensitive to the side effects of this drug, especially fast or irregular heartbeat, dizziness, problems with urination, trouble sleeping, or confusion. Dizziness, trouble sleeping, and confusion can increase the risk of falling. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Loratadine-D, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal interaction. It's also important to check the labels on all your medicines, as they may contain similar ingredients. Additionally, be cautious of using medications containing desloratadine while taking Loratadine. This medication may also interfere with certain lab tests, so it's important to inform lab personnel and your doctors if you are using this drug. It's best to consult with your doctor regarding the optimal timing and daily dosage for taking Loratadine-D. If someone takes too much Loratadine-D and experiences severe symptoms such as passing out or difficulty breathing, they should call 911 immediately. Otherwise, they should contact their local poison control center for help. Symptoms of overdose may include irregular or unusually slow or fast heartbeat, unusual nervousness or excitement, and seizures. If you are in the US, you can call 1-800-222-1222 for assistance, and if you are in Canada, you can call a provincial poison control center. Remember to always take medications as directed and never exceed the recommended dosage. Never share Loratadine-D with others. This medication is specifically prescribed for your own individual needs. Sharing it with others can cause serious harm. Always keep it in a safe and secure place out of reach of children and pets. If you forget to take a dose of Loratadine-D, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. It's important to store Loratadine-D at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.